Chrisitan Ragland, who is the Assistant Vice President, Diversity, Equity, and Inclusion in ATLANTICARE. And I was blessed to be at a stakeholders meeting that Chrisitan had on health equity. And he, as always, he did an excellent job, a very, very needed subject. And I think, Chrisitan, I know you got a busy schedule, but we like to put you in regularly for health equity and healthcare. We need to keep talking about that. And like I said at the meeting, ATLANTICARE is a leading industry in this area. And I think it's so important and so key that ATLANTICARE underscores and stays with the diversity, equity, and inclusion when diversity, equity, and inclusion is under attack all over this country. So before we let you get into whatever subject you want to, tell the audience why it's important for diversity, equity, and inclusion to be in the workplace.
Well, absolutely. Well, first, as always, thank you for having me here. And I would love to be a regular contributor. As long as you find me relevant, I'll stay. Yeah. But, I want to start with diversity, equity, and inclusion benefits everyone. It's not benefiting just particular groups of people. There is an analogy or idiom out there that says that diversity invites people to the party, but inclusion allows them to dance. And I think when we look at diversity, equity, and inclusion, it's making sure that our friends and colleagues who we may not have the same political affiliations, but we still value each other, because we also know iron sharpens iron, and we also know that differences bring opportunities and innovation. And so with that being said, DE&I is not just to benefit those who we deem necessary, but it benefits everyone in that regard. And so DE&I is something that I'm passionate about, but I'm also passionate about doing it the correct way. And I do think that it's important, just as much as I say how important it is to our community and society, but I think it's just as important as a gatekeeper for DE&I to say that there are some actors out there who call themselves practitioners of DE&I who are more divisive than anything. And so we have to make sure that when we look at issues, particularly around health equity, whether it's maternal fetal medicine or infant mortality or Black maternal health, or if it's hypertension, diabetes, that we are bringing in every voice so that we can get to the final solution versus a tattered solution. And so I'm always going to ring the DE&I bell. It was actually when he was mentioning Medgar Evers, one of the, of course, I'd never had the opportunity to meet Medgar Evers, but when I was in college, one of the awards that I received by our chapter, NAACP chapter, was the Medgar Evers Political Action Award. And what really comes to mind is the movie, I think it was called Mississippi. What was the movie that they did on Medgar Evers with Whoopi Goldberg? Mississippi Burnings. And that scene with his children coming out to see him in that state after he had gotten shot, that is something that burns in my memory bank as someone who has children myself at that age. And I always say when I wake up that my job is to make this society a better place for them. Hopefully I don't have to make the ultimate sacrifice to do it, but there were people who did it for us, and we really shouldn't have to repeat that. We should really be able to navigate and leverage and build upon it. So which is one of these days we can have, I would love to bring my Booker T. Washington, W.E.B. Du Bois debate about that. But nonetheless, so I want to thank you, Councilman, for coming to our stakeholders meeting. As you mentioned, ATLANTICARE is committed to health equity. Our CEO and President Michael Charlton laid out a robust vision recently called Vision 2030 that's going to be looking at how we're going to impact not only the area but the region. But I wanted to thank you for coming out. So what Councilman was talking about was last week we kicked off our first quarterly diversity, equity, and inclusion community stakeholders event. This is an opportunity for our community leaders to come into a safe space, into a inclusive space, to share how we at ATLANTICARE can be more culturally competent, more equitable, and more inclusive. And so we had a great turnout there. And then yesterday, some of you may remember a few months ago, I talked about how we at ATLANTICARE competitively won a opportunity with Pfizer and the American Medical Group Association to study COVID-19 management. And so we had the American Medical Group Association with us yesterday to share some results, some data, and some opportunities. But more importantly,
we had some community stakeholders who were able to come to this meeting and share their thoughts on COVID-19 and some of the data. So at the end of the day, health equity is a team sport. We need everyone. We need Democrats, Republicans, we need independents, we need everyone. And so I appreciate everyone who is putting their feet to the fire to make sure that our communities remain equitable, inclusive, and healthy.
Well, I just wanted to thank you for that and bringing us up to date. And you had said several months ago that these meetings were coming up, and now they're actually being implemented. And it's important that people know that, one, that you are there, and that you are not only there, but you are in a position of influence and impact, and you are doing that. And then two, that you are supported by ATLANTICARE. And then three, as you said, the president has laid out a robust, realistic, ambitious plan that includes DEI going forward. I know one of the things we talked about yesterday at the meeting was the perception that the community has of healthcare institutions. And we got in a little bit about the history. Somebody mentioned, I think it might have been you, about the Tuskegee Project and how that impacts still today, how people of color feel about the medical apparatus in this country, because the medical apparatus, along with the government, was complicit in not only injecting African Americans with syphilis, letting them go untreated, and more than that, not even telling them. Why should people in this area trust ATLANTICARE?
Absolutely. Well, first I want to say I'm a part of an executive fellowship with the American Hospital Association. So I was in Chicago a couple of weeks ago when I met some people from Tuskegee, Alabama. And these were individuals who were doing the same work as I am doing, but they made a very clear point. They said they don't like that the national narrative is that the Tuskegee experiment is connected to Tuskegee, Alabama, because it makes them feel that they live in a place that has a negative connotation. So it was interesting because, we talked about it at all ends about the Tuskegee experiment, but there is a population of people who are saying, listen, we don't like when y'all call it the Tuskegee experiment. So I had to change my language, but I thought that was fascinating. But ATLANTICARE, as to your question, I know in my heart of hearts that ATLANTICARE every day strives to do the right ethical thing to make sure we create an inclusive environment. I think some of the data that we were sharing around our COVID-19 management study showed and proved that people do trust the providers and practitioners. Now, do they understand some of the things or all the things that their doctor or nurse is saying to them? Maybe not, but they trust the fact that their provider is going to give them what they need. But I think that there's a national trend that we need to aim for, that we need people not just to trust ATLANTICARE, but we need people to trust healthcare in general, because, my friend Sandy Festa always says wealth is health. And, there is no just mental health, there's just health. It's not just behavioral health, there's health. It's not just physical health, there's just health. And we need to make sure that the totality of health in our community reigns supreme, that wherever they go, that the expectation of good health is, the expectation. So yes, we may treat you well at ATLANTICARE, but if you see something in another state, we need you to have the same vigor to say something about that as well. And so ATLANTICARE, I believe, again, has done a lot to show commitment, whether that's, our food pantry, our healthplex, our federally qualified health center, whether it's the community outreach that we're doing, whether it's the leaders sitting on boards for our various community organizations. I feel that ATLANTICARE is a stable, safe place that people know that at the end of the day, our job is to take care of people.
Well, speaking of outreach and healthcare, I agree with you. May 4th, I think you're doing something with our good friend Dr. Wallace at the Boys and Girls Club. Tell us about that.
Yes, I'm so glad you asked that, and I'm grateful to talk about that. So Dr. Wallace and his team had said to me, and transparently, they said, hey, we want to do a wellness fair. And I said, well, listen, Doc, there's no wellness fair without ATLANTICARE. So we're going to be a premier sponsor. And so I was able to, the Office of DE&I at ATLANTICARE, we are financially and in-kind sponsoring this event in partnership with the club. And so May 4th, we're inviting all of you to join us from 10 a.m. To 3 p.m. Actually, 11 a.m. to 3 p.m. At the Boys and Girls Club of Atlantic City, Pennsylvania Avenue. We are having our medical doctors out there. We're having some nurses out there, some of our clinical team members, along with community partners. But the goal is not to just get out there, cook out, and give out hot dogs, but also provide the resources for people who may need access to their Medicaid or Medicare insurances, who may need access to a provider, who may need to talk to someone about their cancer screenings, who may just need to be in a safe space to talk about maybe they want a job or something like that. So we are looking to make this an annual event as a community sponsor. And if I can be very transparent with you, ATLANTICARE is your regional superior choice in that we take care of everyone and we do it with great enthusiasm. So excited to partner with Dr. Wallace. And
that's a Saturday, isn't it?
That's a Saturday.
Okay.
I don't know if there's a rain or shine day, but I think it's gonna be rain or shine because we got a gym in there as well.
Right. It's a big facility. That's a 217 Pennsylvania Avenue.
317 Pennsylvania Avenue.
317 Pennsylvania Avenue. In fact, that's the site of your defeat in basketball.
Wait, what's
you and my grandson?
Yeah, me and Emil, we couldn't make it. But it's funny, we've been practicing ever since. We're there every Thursday. Shout out to Dr. Wallace. One of the ways that I'm able to engage our residents, our medical doctors that are here, every Thursday, Dr. Wallace gives us open gym from 6 to 8 for our doctors to get in there and have a place to just kind of woosah and just kind of play. So we're there every Thursday practicing for the next go around. But I did check some birth certificates. Some of those kids shouldn't have been on the team that we played.
Well, I'll tell you the same thing I told my grandson. You guys can't beat those kids in the Boys and Girls Club.
We're going to get there.
Yeah.
We're going to get there.
But shout out to our friend Dr. Wallace and ATLANTICARE. Christian, this is going to be a great event, community wellness fair. Can people, if they need healthcare information, can they get signed up or get referred? If they,
yes.
If they, I know you said in the meeting yesterday that sometimes people Medicaid applications lapse.
Yes.
Can they get that kind of information in case that's their situation?
We're looking to have representatives on site for those Medicaid partners and any insurance partner that we get, but we will have people on site to help people navigate that journey. But going back to the Medicaid piece, what we noticed was that a lot of individuals were allowing their Medicaid to lapse because Medicaid is sending you paperwork in the mail, and in order for you to continue the coverage, you have to send it back. If you don't send it back in a timely manner, they can drop you or there's a lapse. And so what we don't want are people who have a lapse in coverage because of simple paperwork. And then that lapse in coverage could mean a screening that could prevent you from a life or death situation. That lapse in coverage could mean your children being able to go to school, be able to get their physicals, things of that nature. And so we want to make sure that community health education is the forefront of our community health outreach.
What's the cost for this event on May 4th?
It is free $99. All right, so come please join us, free, get some food. I think Dr. Wallace has a bounty house as well, but it's free. Come get some free resources. And here's the thing, if you may have everything all together, but you never know if you need this information for people who are in your community. That's the other thing. We have to teach commission, licensed, deputized, everyone to be everyone's an advocate in health. If it's not for you, make sure your neighbor's good. Make sure your neighbor knows that at 45, you gotta get these screenings. Make sure your neighbors know that your children need a primary care provider when they turn 18. And so that we can begin to avoid those disparate things that happen, particularly to communities of color because of lack of education and awareness.
Okay, you've just been listening to Chrisitan Ragland, who is the associate or assistant? Assistant Vice President for Equity, Inclusion and Diversity, Equity, and Inclusion at ATLANTICARE. And we thank you so much for coming on. Chris, don't go anywhere. I just want people to know who you were. And also, we'll mention again, we are partnering with our good friends at Ideal Institute. They are filming, and they're going to be filming as we go forward to help us expand our reach for the NAACP. And Christian, we're going to put you on the same salary as the council president, which is zero.
Did you ever ask, or maybe I can ask you, how do you feel about the government stepping in trying to get rid of DGI?
We talked about this a couple of weeks ago. I think it's in my mind, from a humanitarian standpoint, it's out of place. Right. But I also think that that's a call to action for my colleagues to say, why do they feel that it needs to be? And I think, if I could be very honest with you, because I have colleagues who I love to death.
What they believe in.
I will say this, you got to know how to market your message too. You can't antagonize people and expect them to be an ally.
That's right.
You know, your boy, and I shouldn't say boy, but I know he called you your boy, Reverend Buster Soares.
Yeah.
He said something that I thought at the NAACP breakfast a couple years ago. Remember he said, "Listen, don't be so black that you don't have no white friends."
Yeah,
that's what he said. Yeah.
And I take that to heart, and not necessarily on the color of the person, but the people who may not be an ally at that moment. Take time to educate them on that, because believe it or not, there are people.
When you say educate, why do you have to educate someone on diversity, equity, and inclusion? There's no education. That's a lack of either ignorance or this called playing out racism.
Absolutely. So I'll tell you why you have to educate. I'll tell you why. Because there are people who it should be self-awareness and common sense. But imagine someone being taught their whole life that X, Y, and Z is to happen, and then nobody corrects them. And so that's why we call it teachable moments, because we have to uncorrect the learning that you were given by someone who was wrong. I think about the 42 movie, Jackie Robinson. There was a scene where the young boy watched his dad use the N-word.
Right.
Until Jackie gets on the field and his white teammate comes out and embraces him. Yeah, and that young boy's perception changes because he was taught in that moment that's not okay. Because, hey, someone who looks like me did the opposite of what I was taught. So I do think there is moments for teachable lessons, but then there's common sense, right? I always say there's a difference between a mistake and a behavior. Right. A mistake I can teach you, but a behavior is your willingness to always.
And I think that's a lot with this DEI behavior.
But
a lot of it's behavior.
But here's where the NAACP, and we take the position, NAACP takes the position that we have to constantly reach out and make people allies who may not be allies, because if we were to turn the clock back, as some people want to do, 20, 30, 40 years ago, people of color didn't have the right to vote and the right to be in careers that they wanted to, and the right to even be where you're at.
Yeah, absolutely.
In ATLANTICARE, or the right to even have doctors of color have the ability to go to the hospital and actually admit patients. So the ability to reach out to people and not alienate them is very, very important. It's key.
You gotta watch out who you reach out to too, because remember, now we have more hate groups than we've ever had.
Right.
Statistics shows it from the JDL on down. We have more hate groups on. Look at the college campuses. We ain't talk about Palestine. Just hate groups, period. So you want to embrace, you want to make sure you have teachable moments, but you also want to be aware.
Not everybody's going to be.
There's no teachable moment, or
you just got to know who they are.
You got to know who you embrace.
But here's and you're not wrong, and you're right. There is a unfortunate spike in anti-Semitic incidents, in Islamophobia, in racial incidents, and a lot of that is because of the fact that the demographics of this country is rapidly changing.
Sure.
More people of color are coming into the country, and there's some people who take that as an opportunity to play on people's emotions.
That's what it is.
And their weakness.
Fan the fire.
And so that's what we stand, as they say, in the gap. The NAACP's job is to, first of all, let people know that we do better when everybody's involved.
Of course.
And we do better when everybody participates and everybody feels a part of this country. And our voice has to outweigh the voices of hate. And I was thinking about this the other day. I think we all realize this. If you look back to what this country's been through in the last couple of years,
that's right.
We lost over 1 million people to COVID. That is a major, major issue.
Nobody talks about that.
Nobody talks about it. Even in my district, same thing in your district. Yeah. We had people who actually died. Got COVID and died. And that's not theoretical. No. That's not political.
That's a fact.
That's real. And still, as Dr. Cupanini, other contributor, medical contributor says, still today, right now, There's 300 people a day dying from COVID.
Right.
In addition to all the other things that we've been through. In addition, look, it was just, I'm getting ready to do, on May 25th, Christian and Council President knows because he attends, we do a tribute to George Floyd.
Okay.
The fact that he was murdered on May 25th, 2020. And we just bring people together and reflect on that. But that was a tremendous, traumatic experience for our country.
Yeah.
To see a person actually get killed.
Human sacrifice, right? Live.
Live. So my point is, what's my point? My point is that those of us in civil rights and social justice, health equity, even though you're in health equity, you are in civil rights and social justice.
Absolutely.
Because the right to have health care is a civil right.
Absolutely.
And the right, if that's denied, that's a social injustice.
Absolutely.
I remember the lady said yesterday, President, in Christian's meeting, the lady, I forget her name, but she was from the group. She said that a lady who happened to be white, her husband happened to be African American. The lady went to a medical facility and reported her symptoms, and they gave her medical referrals and all that. Her husband went separately to the same medical facility and didn't get the same treatment.
Well, Charles Drew. You ever heard of Charles
Drew? Yeah.
Blood plasma.
Yeah.
Car accident. How did he die?
Yeah.
Lack of blood.
Yeah. Couldn't
get the transfusion.
But he's the main one we talk about with blood drives.
There you go.
With transfusion.
So a lot of people are not aware of this, you know what I mean? And they need to be, so that's why sometimes I'll just shoot it right on in there to let you know. I always know what I'm talking about. You know, I study. I know where I come from. I know where we should be. We haven't gotten there yet, but I see they're trying to turn back the hands of time. Well, we can't have that.
That's why our theme is standing for and protecting democracy.
That's it.
And like I said, when we first said that, way back in, I think it was before the holidays, but now we see that is see it right here. So we're going to again, let me make that announcement. For those of you who aren't able to make it Saturday, April 27th, this Saturday at Hard Rock, to the Freedom Fund, to see the council president is going to get the President's Award, and Kristen is going to present the Health Awards to Dr. Mamadou and Dr. Kupanini. We thank him for that. But there are people who want to donate and can't. I'm not donate. They want to attend and they can't, so we want them to donate. So please send your contributions to P.O. Box 1182, Absecon, New Jersey. We'd be happy to receive that. And we're going to still partner with Kristen on this health issue.
Yes.
This is a critical issue. Let me ask you another question, Kristen. You talked about the health plaques. And I remember from a meeting you had that the manager of the health plaques said, if my memory serves me correct, that there was a 12-year gap in life expectancy with people lived in Atlantic City and people in the county. How do we address that?
So that's what
is my memory correct?
Yeah, and that's actually one of our strategic goals with Vision 2030 is to increase life expectancy by 5 years in Atlantic City. One is we have to get people to the doctor. We can't delay someone who is, so we had something on colorectal screening a couple weeks ago. The screening age for that is 45. We can't get you there at 65 and then it's too late. It's just, and we can't allow that to happen because you're afraid to find out. We got to change the narrative of that. So one is the education. The other piece is access, right? You know, we need to make sure that we can't tell people to go to the doctor, and then when they call the doctor, they can't get an appointment for 6 months, and then 6 months we lose them because they're like, you know what, it wasn't meant to be, and so now we lost one prematurely. And then the other piece, and this may sound maybe not related, but it does correlate, is workforce development. We got to get people jobs that are going to allow them to be paid a healthy wage and good health care insurance. We also need to make sure that we're addressing the social determinants of health. So we can't just see somebody in the hospital and say, oh, you're better, and then we don't address the fact that they don't have food, they don't have stable housing, they don't have transportation to get to their follow-up. All of these things play into, I call the circle of life, you know, the tenets of true healthcare, and that's how we'll increase the longevity of people's lives. Now, Ms. Fudge, our former Secretary of HUD, she came for the National NAACP convention at the Convention Center in Atlantic City a couple years ago. And she said this. She said, "Do you know that your zip code determines your life expectancy?"
That's it.
Right.
And I don't think it takes no disrespect to a rocket scientist, but I don't think it takes a rocket scientist to see that there's a difference in expectancy of life in different communities, and zip codes. Our job is to make sure that everyone is on the equitable playing field. Not equal, but equitable, meaning everyone's treated fairly so they have access to the same resources so that our children and their children's children have the ability to grow and thrive and not necessarily.
And you know, you break it down to its lowest common denominator. Kaleem and myself, we always send letters to people's, if they have a funeral, we make sure, because they're part of our community.
Right.
So we scan the obituaries every day, and you see the ages. Whites, 90, 89, even some as high as 100. I just looked in the paper the other day. We just buried a young man, 39 years old.
Yeah. My grandfather died at 49 years old.
39.
My grandfather.
Well, we talked about him before. The gentleman in Black Panther.
Right.
He was what, 43?
43. Colorectal cancer. You know, and still we have people who are not getting a colonoscopy at 45. Now, it was funny. We did have a colorectal screening event, and shout out to all the community members that came out. But one of the questions was, listen, when can I stop getting these colon?
I get one. I can do for one every 5 years or whatever they said, whatever I'm doing.
But we got to create a condition where our community where we are screening for these things and not missing it. And you know, this work being done even with sickle cell. You know, I'm still on that, working with some hematologists on how do we get education on sickle cell, because that's something that really impacts our community. But overall, I'll say this and I'm done. I was talking to a doctor.
Keep going. This is important.
I was talking to a doctor friend of mine who is of Eastern Asian descent. And I asked him in front of these high school kids, why did you become a doctor? Now, I was expecting an answer like, oh, I always wanted to be a doctor. I wanted to make money, all these things. He said, I looked at my family and I said, we suffer with a disease and nobody in our family is a doctor. So I'm going to be that person. So when my family gets sick, they don't have to wait on anyone. I am their direct access. And I thought about that. In our communities, we need to have the same fortitude of, let's not send our kids off to college to be liberal arts majors with no purpose. Tell them what the need is, so we can create a community that has exactly what it needs. We call it alchemy, taking what you have to produce what you need. So we also, as adults and as people who say we love the community, need to make sure our kids are going to school for things that the community needs before they go off to California and North Carolina and Atlanta to be what that community needs when our community is suffering. And I can talk about that with Dr. Henry Louis Gates, who opened up my mind in college when he went to a prison and asked this brother, why are you in prison? And this man articulately said, I'm in prison because while my colleagues that don't look like me saw a fireman, a lawyer, a police officer, all I saw was someone who wasn't taking care of the community. And I became what I saw. And so we got to also own the responsibility of, let's not just get excited for our kids getting accepted to college. Let's give them a plan and say, you need to be this. And we talk about the other communities that do this, and it's successful. They tell me this all the time. We got to be just as adamant as well. But we got to create those spaces for them as well too. So that's why, shameless plug, ATLANTICARE, we're launched that we're bringing a medical school to Atlantic City in partnership with Drexel University, and I'm hoping that will stir up some more diversity in medicine as well.
That's important.
That's it.
And you are the health counterpart to the council president. The council president comes here every week and talks about voter registration, voter awareness, voter involvement. That's important. We have to keep pushing that, and we need you to keep talking about health disparity, health education, health environment, health equity, and health involvement. We need to keep pushing, just like the council president and us want people to be registered to vote. We need people to have a primary doctor, to know why that's important, to know their family history, we had Dr. Regis talking about that, about weight loss and diet. We want to get back on that because there's some things that are hereditary and you can't do that much about, but there's some things that you can impact that impact our health. Tell us about that.
Well, I mean, first of all, it's your diet, right? A lot of the disease states that particularly people of color, are dying from prematurely is all about diet, right? I just saw something, since we were talking about colorectal cancer, they tell you that's one of the key factors: red meat, alcohol, all of these things that you're doing in excess.
Say that again.
Red meat, alcohol,
smoking.
Of course, there's the genetic piece, the hereditary piece to it all. But think about this. One of the things that can save your life from these disease states is also knowing your family history and understanding that hereditary upbringing there. And so, but I always think about this, and I'm not trying to be funny, but we allow the media and rappers and everything talk about single family homes but what I see is, if I don't know who my father is, who am I to get the information from? Hey, you may have suffered with prostate cancer. You may have suffered with diabetes. I need to know these things because this is how I'm going to be able to attack it early. And that's why we're seeing more kids juvenile diabetes, because we're not addressing these things at the forefront. But it takes cultural competency as well, right? And I think the other onus is on the doctors and providers. If I'm a provider, I need to understand that, hey, I may be dealing with a patient who, it may not have had the same upbringing as I had. So I'm not going to put expectations on them that pretty much are outside of their purview. I'm going to educate them on, hey, you may not have had this information, but I need you to know, if you want to secure longevity, I need you to change your diet. I need you to do this. I need you to, and I need you to talk to your kids about this as well.
And that works. Education works, because I can remember that when smoking was a big thing, people smoked in the movies, people smoked in the street, people used to smoke on the bus. A big shout out to Senator Lautenberg, of blessed memory, who passed the legislation. That's why voting is important.
That's right.
Senator Lautenberg was an elected official.
Yes.
He passed the legislation to stop smoking in public places, in theaters, in bars, in restaurants, and people said it was going to be the end of the world.
Yeah.
It wasn't.
No.
And we can see people don't even smoke in movies and TV anymore.
You can smoke on a plane and when the casinos. You can smoke in the cafeteria. You can add years to your life. I used to be a smoker. I haven't had a cigarette in over 26 years. I used to be a drinker. I haven't had a drink in 33 years because I took the time to say, you know what? If I want to live longer, I have to do certain things to benefit me.
Let me just key on the part of ATLANTICARE's future in terms of lifting up the closing the gap in life expectancy. You said 5 years? And over what period of time?
So 2030, so 6 years, 2024 to 2030.
Okay.
So we are working for the next 6 years to create interventions that's going to increase the life expectancy by 5 years.
People living
in Lang City. Because it trickles down to other communities too, right? Just so funny, because I'm always like, man, people love the name Atlantic City. I saw a car dealership that's not in Atlantic City that says Atlantic City.
Nissan of Atlantic City.
Listen, that's a great thing. But we want to increase the life expectancy by 5 years. And someone says that don't seem like a long time, but think about what you could do with 5 years.
That's a long time.
That's 5 years more that you can leave a generational wealth to your children. 5 years that you can go back to school and leave something. 5 years that you have with family. And so ATLANTICARE is creating interventions around social determinants of health, around housing, around transportation, around workforce, that we can ensure that we are adding to people's lives versus taking from it.
That's important. You've been listening to Chrisitan Ragland, Assistant Vice President, Diversity, Equity, Inclusion, ATLANTICARE, and of course, Council President Aaron Sporty Randolph, the Council President in the Lang City and the First Ward Representative in the Lang City. Chrisitan, before we close out, we're in our last 4 minutes. You have anything to say today?
Actually, yes.
Actually, yes.
Chrisitan,
our engineer.
Real quick, I was kind of chomping at the bit when we first started talking about.
I saw the way your glasses were twitching.
Basically, what you do and why it's important to have the conversations. I'll be honest with you. Until you came on the scene, there were things that, as far as diversity, equity, and inclusion, that I didn't think of, and I'm sure that some of we kind of just get in a way where it's like we're used to things being done the way that they're being done, but from a healthcare aspect, okay, so we know the infant mortality rates and things like that, but we don't always really think about why Christian's job is important, why it's important to have somebody there that is thinking about these things and not just because for me, that makes sense to me. But there are things that he does that they may not necessarily affect me personally, but when it comes to, gender identity and things like that, there are things that he's doing for other communities that are important to that community. So like I said, when it wasn't until he came on the scene that I was kind of like, duh, why would we not? You know what I mean? So yes, it is very important for us to continue to have the conversation and to enlighten people on, why those positions, why diversity, equity, and inclusion is important.
And I appreciate you saying that, because I do a lot of work with veterans, right? A lot of people don't forget these are protected classes, right? So I work a lot with VA. The VA would get people what they need. Diversity has many dimensions, but I'll say it this way, and Dr. King said it better than anybody could have said it. What affects you directly also affects me indirectly. That's the interrelated structure of reality. I can't be what I ought to be until you are what you ought to be. And that's how I look at DE&I.
Okay, thank you so much. One of the ways that we are spreading our word, our good friends at Reliance, not Reliance. Ideal. Thank you. Ideal Institute. Thank you so much.
Thank you
for being here. Ideal Institute, so that we can expand what we are doing, expand our audience, expand our reach.
Yes.
Very, very important topics. Council President, 30 seconds, last minute. Last comment.
30 seconds. VOTE. That's what you need to do. VOTE. That's what you need to do.
Chrisitan Ragland, 30 seconds.
Go to the doctor.
And we can put that on a bumper sticker. Vote and go to the doctor.
That's what we had before.
Right. We appreciate that. Thank you so much, both of you. Chrisitan, also thank you for your comments.
Yes.
I knew Chrisitan was ready to go. I saw the glasses. But this is important information in all seriousness. This is really life-saving information.
Life-saving.
Voting is life-saving
Life-saving.
at the governmental political level. But what Chrisitan is talking about every day is life-saving. We can get people to change their lifestyle, to stop smoking, stop drinking, to eat better, to eat more healthy. We can do something with our community and every community. And I'll say this in closing: if we can increase the educational level, the health level of Atlantic City, that will bring the whole region up.
Absolutely.
So it's not just that we are so concerned about Atlantic City. We're concerned about everybody.
Everyone.
And if you bring the least of us up, not in the human stats, we're all human, but in terms of the 12-year lifespan. When she said that really got to me. When she said there was a 12-year difference, and it's the same. I got a friend of mine in Philly, and they have a graph they put in the Inquirer, and they said as you go from West Philly to outskirts of Philly, each zip code, the life expectancy changes.
Yeah.
And listen, we're not even going to talk about the violence aspect.
No.
Like that's a whole different.
That's
Unfortunately, I lost
different
two Penn State classmates last week in Philly to gun violence.
Is that right?
Two classmates,
Yeah.
39, 30 years old.
Wow.
So it's not all health. There's some things that we need to address.
We're gonna have to talk about that because violence is a public health issue.
That's it. Definitely.
And we have to talk about that. You've been listening to your NAACP Speaks. Our special guest, Chrisitan Ragland from the ATLANTICARE, Vice President for Diversity, Equity, and Inclusion. Of course, our regular contributor, Aaron Sporty Randolph, Council President, City of Atlantic City, winner on April 27th for the President's Award for his work in government, and the esteemed Chrisitan, who is our engineer and chief young adult commentator. Thank you. Thank you. When we fight, we win. When we fight, we win. When we fight, we always win. See you next week.